Good afternoon, everybody. My name is Riley Citrowski here at this hospital. I will be going over what kind of to expect with the whooping cough outbreak that is happening right now. So, as we know, whooping cough has been spreading across our country or our county, excuse me. Whooping cough is also known as pertussis. This can cause serious illnesses in babies and children and teens and adults. Symptoms of this, they usually develop within 5 to 10 days after you're exposed. So as soon as you are seen by somebody that already is like has whooping cough, it typically will take 5 to 10 days before you really notice it. Um, the disease usually starts with cold-like symptoms, your runny nose, your cough. Typically, sometimes it can have a fever. In babies, the cough can be minimal or not even, or like even they can't even have it. Babies may have symptoms known as apnea. And that's when they pause in their breathing. That's most dangerous for babies. About half of babies younger than 1 year old who get the disease need care in the hospital, and so that's kind of why we're going over that part. Patients coughing for 21 days or less, we would like our staff to collect, swabs up the nose, just like how we test for flu. And that's going to be used as a test, and we're also going to culture it to see if the bacteria will grow over the next 24 hours. We do not want to delay the treatment. We want to treat them as soon as it's appropriate with antibiotics while waiting for their test results to come back. If they've been exposed to it, that'd be one reason to start it. If they're susceptible to getting whooping cough, then we would start it. We also want to make sure that we're just documenting and having appropriate papers to be sent home or like home to parents or daycares or schools. We do strongly consider antibiotic prophylaxis for all household members. If a pregnant woman or infant less than 12 months old or anyone with a weakened immune system lives in the household, that's just kind of to make sure that everyone's safe and covered. Next is the people who have been coughing for more than 21 days. Typically, we won't be running the test on you anymore just because after 3 weeks of the cough, typically the bacteria isn't as sensitive, so it's not going to be growing and we're not going to see it as much on the test. For most patients, antibiotic treatment is not required anymore just because it's no longer necessary after 21 days. Your antibiotics or your antibodies inside of you have already been working to fight this and, fight off the infection. We do still want to treat infants and pregnant women in their third trimester up to 6 weeks after cough onset just because their immune system is weakened. The patient is no longer infectious and can return to school as well after 21 days. And then resources and external vendors. With this outbreak, we will be reaching out with other facilities for resources. And definitely I will be reaching out for, making sure that we have those antibiotics on hand, as well as vaccines. We will maintain updates with the surrounding pharmacies just so that way we can know who is going to have the medications on hand for us to send our patients there. Resources, they will be scarce at this time, so we want to make sure that we're using them wisely and not just kind of giving them out wherever, whenever. And we definitely want to be treating the more severe people first, such as people with weak immune systems, pregnant people, young children. And also, we will put together to fight this outbreak with our resources from neighboring hospitals, such as we are going to have the protective equipment that we will use to ensure that our staff is healthy, as well as our patients. As soon as we have any staff members that show any signs of the cough or, the fever, we do want them to no longer be working with our patients. So being very conscious about your own health is going to be definitely number one. Ethical strains. Ethically, we will be challenged due to knowing and acting on what is right and what is wrong. We'll need to put aside our own feelings about the way things are ran, and this is one of those things where you notice that the parent doesn't like immunizations, and while that can be an ethical kind of standstill with a patient and one of our providers, and we really don't want to have that happen. Also, we want to make sure our teamwork is up to par for this outbreak just because, we want things to run smoothly and efficiently. Point of contact. So each department's going to have a head person that we're going to try and contact in the during the outbreak, just so that way we have point guards, kind of like that, where we can really just go to that one person to ask about everything that's going on in the department to make sure that that person is aware of everything that's going on. That's going to be kind of a big thing. So many changes that are going to be coming around the hospital is, during the outbreak is that each patient will be evaluated for having the whooping cough as well as the family members with them. Um, and as before, we did go over kind of the guidelines of who's going to be treated and who's not. All patients who test positive should be separated from people who are not infected with pertussis. The nursing station will have sections that will be used for testing and also vaccinating for those who are not yet vaccinated. Next, each area of the hospital will have the resources of hand sanitizer and masks for the staff members and patients. We want to confine this as fast as possible. The beds will be used for more emergent patients that need IV antibiotics and other emergent needs. We will be transferring our patients that are stable. Those who are not infected but are being held here in the hospital will be moved to the West Wing away from the outbreak. With all these changes, questions will be arising. I do apologize that I did run over this pretty fast, but the PowerPoint will be accessible online on the hospital's website. And also, we'll have flyers kind of floating around the hospital as well. If you have any questions, please feel free to reach out to me. Again, my name is Riley Citrowski. Also, anyone working in the hospital will have the knowledge that I just shared with you, and they can also break it down a little bit better for you guys. And I hope that this is kind of a good outline as to what to expect that's going to be coming. Again, if you have any more questions, please feel free to reach out to me. And yeah, we'll get through this, okay? Thank you. Bye.